This is Shelley Kraft coming to you live on SNNLive. We're at SEMDA, the Southeastern Medical Device Association 2014 conference in Atlanta, Georgia. Standing next to me is John Hoggle of Adhere2Care. It's a private company. John, welcome to SNNLive.
Thanks, Shelley, for having me on. Look forward to speaking with you.
Let's talk about Adhere2Care. Please tell our audience.
Okay. Adhere2Care is a telehealth company. We basically have two platforms. We have a cellular platform that connects information from patients, from soldiers on the battlefield, from first responder groups as they are searching for casualties. And basically our mobile application collects this information, displays it on an Android device, be a tablet or a cell phone, and then the information is sent to our website where doctors, nurses, or anyone that's concerned about the safety and health of the individuals that are being monitored. Our application has been trialed in the Navy lab out in San Diego. It's also been trialed in the Joint Chiefs of Staff lab up in Suffolk, Virginia. It's passed with flying colors in both of those situations. We're now entering into the hospital marketplace, and we will be taking care of patients that have your chronic diseases like heart failure, diabetes, and COPD.
Let me ask you a question. This is an idea that you fellas generated and your people generated within the corporation. Do you find it to be competitive yet, or are you still is it still new?
Well, that's a really interesting question. I've been involved in remote patient monitoring since 1997, and I have viewed many changes in the marketplace. We had a company that actually did Holter monitoring and transtelephonic event monitoring.
You mean for the heart, right?
That's right. That was concerning arrhythmias that patients might have, some of them lethal. So we monitored around 5,000 patients with that system over a period of 8 years. We also did pacemaker surveillance, dealing with patients that had pacemakers. What I began to understand is the patients in their home are very isolated. And basically they look for equipment, devices, people that they can talk with when they are having a situation developing with their health. And they really want to stay in their home. They don't want to have to travel 30 miles to a physician, 50 miles to a hospital. So basically the concept of what we're doing was brought about by the need and the desire to help those patients. At the same time, we have the best medical system in the world. Our doctors are top-notch. If you can hook the patient and the doctor together, it may be for a 1-minute call, it may be a doctor just reviewing information, then there's a need for that. And I've always thought in healthcare, if there's a need, a solution needs to be developed to solve that need. So we developed our system based on saving lives and saving money to the healthcare system. It has been a long process. I actually began in 1997 working on the forerunners of this product. What we're beginning to see, though, is light at the end of the tunnel. Basically, more and more insurers are looking at it now saying, this is one of the answers to saving dollars in our healthcare system. Physicians are beginning to view it now as an added tool in the care of the patient, and they're very excited about it. So we think over the next 18 to 24 months, we're going to see a shift from a service that people looked at and said, well, that's too far in the future for us, to a service that is going to be demanded because it's so needed, because of the cost of health care and the actual need of the patient.
So, John, For interested people, please. And there's many of them out there.
Yeah.
What's your website?
Our website is Adhere2Care.com.
Now, Adhere2Care is ADHERE, the number 2, CARE.com.
Exactly.
John Hoggle from Adhere2Care. It's a private company. I'm Shelley Kraft. This is SNNLive. We're at SEMDA, the Southeastern Medical Device Association 2014 conference right here in Atlanta, Georgia. John?
Thank you, Shelley.
Pleasure to have you on.
Okay.